Hi everyone, in today's video I'm going to go over the treatment of fatty liver disease and how it relates to nutrition. In today's video I'm mainly going to talk about a little bit about lifestyle management, but then also some of the new medications and pharmacotherapy that's involved in those with living with this condition. My name is Bally and I'm a specialist liver dietitian. Right, let's get straight into it. So what is metabolic dysfunction associated steatotic liver disease? Mouthful. Previously known as NAFLD, is the buildup of excess fat within the liver cells, and it leads to progressive inflammation and cell damage. It can also lead to cirrhosis, liver cancer, and liver failure, and predominantly affects 30% of the global population. The first line approach, as soon as you've been diagnosed with this condition, is we need to try some level of lifestyle management. That's going to be exercise, nutrition, and stress management. That is going to be the first line of approach. But for some people, sometimes we catch the inflammation too late, and we need to give them a medical chance and give them some help in hand, because the body starts to fight against itself, and actually it makes it more challenging to do it just with this treatment. And there's no shame to having to get help. There's no shame to having to use medications. That's what they were designed there, to help your body in terms of fighting this condition. So what pharmacotherapy do we have at the moment? So approved, we had Rezdiffra in the FDA, which was the first medication approved for MASH. And it's a thyroid hormone receptor beta agonist. And essentially what they've seen is it reduces 30%, 36% of MASH resolution in reducing the buildup of inflammation within the steatotic liver cells. And for more modest benefits off-label, you will see prescription of 800 IU vitamin D, and you will also see some pioglitazone being prescribed as well, which is modest in those who have non-diabetic MASH. But Rezdiffra, resmetirom is probably the top medication. Now, emerging therapies, what are those? So it's going to be your GLP-1 antagonists, and these are amazing for those with liver disease. And tirzepatide and semaglutide have shown really great results in the new clinical trials. Manjaro, Wegovy are highly effective. They reduce inflammation, they reduce de novo lipogenesis, and they enhance fatty acid oxidation. Essentially, they allow your liver to use the fat that it provides as energy more efficiently, and it also stops the production of the fat that it's doing at the same time as well. They also lead to significant weight loss, which actually then in turn has a help on all the other metabolic factors too. And you'll see in these graphs on the next slide that even without worsening fibrosis, the tirzepatide and semaglutide are miles ahead of anything else in terms of placebo and a just lifestyle and exercise management. So almost a 60% reduction in MASH with tirzepatide and semaglutide, and guaranteed improvement of at least one stage with tirzepatide and semaglutide. It's an unbelievable medication for this patient group, especially when it becomes more and more challenging to manage it with lifestyle alone. In the future, what are we probably going to have? The future of medication is probably going to be more personalized nutrition and personalized medication, where we will have GLP-1 inhibitors being combined with similar drugs, and we will use these in combination with targeted dietetic and nutrition therapies to make sure you're maximizing the benefits of these drugs. But 100% is only going to get better for this patient group. Lifestyle change remains the foundation of MASH management. The approval of these drugs and the success of GLP-1s will be the future once we get that supply issue constrained. And hopefully we'll start seeing more of a combined approach where you will be prescribed your GLP-1 by your consultant, and then you'll be referred to a lifestyle management clinic with a dietitian to help you make sure that you're maximizing the effects of those medications. That's all for today, guys. Thanks for listening. Peace out.